Hello. Hello. Am I audible? Hello. Hello, everyone. Am I audible and visible to all of you? Give me a thumbs up if I'm audible and visible. Good evening. Okay. All right. Okay. So, this is a very important session. We will be discussing all the previous year questions, okay, which was asked in community medicine from the FMG papers. Okay, if you're a NEET PG aspirant, this is also an important session for all of you. Okay, so these sessions will keep on continuing for some time till we complete all our previous year questions. All right. So before that, I want to tell you that Unacademy has started a NEET PG 2023 All Educator Ultimate Revision Batch, which has started today, September 30th, where we'll be discussing test and discussions, PYQ, image-based questions, and a lot more. So you can use the code PSM Live, or also you can use PSM 10 and subscribe. And the best thing is, today is the last day to avail the Unlock 20 offer, okay, where you're getting 20% off on any Unacademy Plus or Iconic subscription. Okay, so if you still want, you can subscribe and make use of this opportunity of Unlock 20. Okay, also we're going to help you ace your FMG December exams. We have started a last mile revision batch also for our dear FMG students. It has started on 16th September, so it's still not long. You can still become a part of this. Use my code PSM Live or PSM 10 and avail the exciting offer of getting 20% off on your Plus and Iconic subscription. The offer ends today. Okay, and we also have an improvised QBank 2.0 now available for NEET PG learners on Unacademy. It's a totally improvised question bank with a lot of clinical questions, integrated concept based questions. Okay, so this is the offer that I'm talking about. Today is the last day to avail this Unlock 20. Get 20% off on your subscription. Okay, all you need to do is use the code PSM10 or PSM Live. So that's the information that I wanted to share. Now let us begin with our FMG previous year questions. So like I said, these sessions will continue for some time. Today is the first episode of it. We'll have it for almost an hour. Let's see how much you remember and how much we need to revise more. Okay. So the first PYQ, which is not very difficult. Can you identify the logo given in the image below? Come on, I want everybody to answer. First aid, Suraksha Clinic, International Red Cross, or NACO. So these are all previous year questions only. Okay, very good. So I'll be telling you the golden points also which can come along with this question. So this is Suraksha Clinic. Okay, how can you identify Suraksha Clinic? There's white cross with a red dot. Now my next question to all of you is, Suraksha Clinic is whose initiative? It was an initiative by Ministry of Health and Family Welfare, National Health Mission, National TB Control Program. Which program launched this? Like under which program did this initiative get launched? So it was an initiative of NACP. This is golden point number 1. Okay, this is an initiative of National AIDS Control Program under which NACO launched this. Okay, and we want to promote what? Sexual and reproductive health. Okay, sexual and reproductive health. Is it clear? So this is one image which is very, very important. Now this image you can get confused with International Red Cross. How does the image of International Red Cross look like? Just for you to revise, देखो ये है image International Red Cross का. Okay, just have a look at it again. Appreciate these images, guys. This is International Red Cross. Now if you look at International Red Cross, what do you see? Completely red. Come back to Suraksha Clinic, white with a red dot. Okay, so this difference you have to know. International Red Cross, how many of you can tell me the headquarters? Where is the headquarter of International Red Cross? When we'll be taking the image based discussions, फिर हम लोग और images भी पढ़ेंगे. Since FMG exam is now round the corner, I'll also be starting a few crash course for diseases on YouTube channel very soon. Pretty soon all the links will be shared for the upcoming classes and strategy for FMG December 2023 exams or 2022 exams. Okay. Very good, guys. Very good. This is the headquarter of International Red Cross is in Geneva. ठीक है. दूसरा एक सवाल यहाँ पूछूंगी मैं. Who founded International Red Cross? Who founded International Red Cross? This is an important question. It was founded by Henry Durant. Okay. So remember these two additional points. International Red Cross headquarter is in Geneva and also it was founded by Henry Durant. But हमारा PYQ क्या था? Our PYQ was Suraksha Clinic, so that you don't get confused with the image of International Red Cross. I have shown you this. ठीक है? So have a look once again. White cross with a red dot is Suraksha Clinic, initiative of National AIDS Control Program. Completely red in color, International Red Cross, headquarter Geneva. Okay, one more image since it was given in the option NACO. So have a look over here. This is NACO. Okay, this is National AIDS Control Organization. Okay, National AIDS Control Organization. Where is the headquarter of NACO, everybody? National AIDS Control Organization is India's initiative. So, इसका headquarter कहाँ है? इसका headquarter is in New Delhi. Okay, and which is this one? Very good, Alia. New Delhi. Which is the next symbol which I am showing you? Which is this next symbol जो मैं आपको दिखा रही हूँ? ये दूसरा symbol किसका है? Whose symbol is the next one, so that you don't get confused? I've put these two images together. This is UN AIDS. Okay, this is UN AIDS, international effort to control AIDS. Okay, and where is the headquarter of UN AIDS, everybody? Now it starts with the UN. What is the general rule I've taught you? That all the organizations which start with the UN have their headquarter in New York. However, the exception is UNAIDS, which has its headquarter in Geneva. ठीक है? Everybody know. Mohit, Chitranjan, ठीक है? It starts with the UN, should be in New York, but this is an exception. Okay? All the organization which starts with the UN have headquarter in New York. Exception is UNAIDS, जिसका headquarter Geneva में. ठीक है? So did you see, with one MCQ, with one Suraksha Clinic, we have done so many other questions also. You've looked at International Red Cross logo, you've seen the headquarter, you've seen NACO image, you've seen UNAIDS image, and you've also seen the respective headquarters. Thumbs up. Proceeding to the next PYQ for the day. Okay, so we'll be looking at a lot of golden points also with the previous year question. चले आगे बढ़े? चलो. Okay, this is question number 2. A man came for checkup after his father had a cerebrovascular accident due to hypertension. What type of prevention? Now, everybody, one question from levels of prevention is very, very common in FMG exam, NEET PG exam, all the exams. एक question आता ही है. Now, everybody is marking क्या? कुछ C and most of them are marking C, some are marking B. अब देखो, remember one thing, okay? any form of health checkup, okay, any form of health checkup is done to do what? Why do we do a health checkup, guys? Why do we do? Of course, it's useful for NEET PG also, I've told before. And this question can clearly come in NEET PG. A lot of questions from FMG get repeated in NEET PG. And NEET PG के FMG में भी आ जाते हैं, ठीक है? So if you're here, do revise them. Any form of health checkup is to make an early diagnosis. And what is early diagnosis? Early diagnosis is nothing but screening. Okay, and this will be which level of prevention, everybody? So this becomes secondary level of prevention. Okay? No, secondary level of prevention means the disease has already started and we want to prevent the disease from progressing into an irreversible stage. So I'll ask you, primordial level of prevention is applied before risk factor or after risk factor? It is before risk factor, okay? There is no risk factor present. So we do not want the person to start smoking. Like, do not start smoking. Primary level of prevention is applied after risk factor. Okay? That means risk factor is present but disease not started. And how do you achieve this primary level of prevention, guys? Through two modalities, which is health promotion. One is health promotion, and what is the other one, everybody? Specific protection. Okay. And what is secondary level of prevention? What is secondary level of prevention? Disease शुरू हो चुका है. Okay, disease started. All right, disease started. Maybe signs and symptoms have not yet come. So we want to detect the disease at its early stage. Disease started, but there are no complications. These are all very important points. Okay. And how do we achieve this? Through two modalities, early diagnosis and treatment, right? Early diagnosis and treatment. And what is the last level of prevention? Tertiary. Tertiary means disease has progressed and complications are present. Okay, complications are present. We can't reverse the disease, but we can limit the disability due to the disease. So tertiary मतलब क्या होता है? Disability limitation. And what is the other one? Disability limitation and rehabilitation. Clear? Very, very important. Before risk factor, primordial. After risk factor, but disease has not started, primary. Health promotion and specific protection. Disease has started, but there are no complications. So to make an early diagnosis and treatment, secondary. Complications are present, so limit the disability and rehabilitation, tertiary. Clear? Now here person's father has died, so they may be sharing the risk factor. The son is now worried that कहीं उसमें disease तो नहीं start हो गया. Okay, of course you can reverse the disease in secondary level, Deepti. You can treat the disease here. That is why you are detecting it early. Okay, the disease can be treated. Early diagnosis and treatment. But tertiary में complications has come. ठीक है? Okay, that he doesn't. Question will never mention that he has hypertension. But whenever you go for checkup, Arita, whenever you go for a checkup, dear, you don't go for a checkup to the hospital to get your risk factors screened. You go to a hospital to screen for a disease. Like whenever we go to a camp, health camp. Why do we go to a health camp? We go to a health camp to find out whether disease has presented and has started in us or not. We are not having signs and symptoms right now. But क्या हमारे में disease शुरू हो गया है? उसको पता करने के लिए हम लोग checkups करते हैं. Clear, Arita? So in like school health checkup, everybody. Can you tell me school health checkup is which level of prevention? School health checkup is which level of prevention? Give me an answer if this comes. Primordial, primary, secondary, tertiary. School health checkup. किस क्या prevention है? School health में checkup होता है ना? Why do you want to do a checkup of the students? Not because they have risk factors. Because they are eating chocolates, they might be having dental ailments. Okay. Most common infection reported in school health checkup is again an MCQ. Most common infection reported in school health checkup, guys? Anybody can tell me the answer to this one? Most common infection reported in school health checkups kya hai? Which is the most common infection repeated? You will say dental infections. Okay, dental infections. Now we are screening, we are examining to see कि कहीं कोई disease तो नहीं हो रहा है. Is it clear? Any form of health checkup is secondary. So I have written it for you. Primordial before risk factors, primary after risk factors, secondary early part of disease, that means no complication, and tertiary means late part of disease, meaning complication present. Okay, so the patient has come for checkup means he came to detect the disease early and not for preventing it. Is it clear? The same thing we have discussed. Now I'll give you one more example. Can you tell me? No, not always secondary. Most of the times, like if I'm screening before pre-placement examination, कोई ये बता सकता है ये क्या है? Pre-placement examination, ठीक है? Pre-placement examination in occupational health, everybody. Pre-placement examination in occupational health. ये कौन सा level of prevention है? Since Mohit has asked, can anyone tell me? You have to start working in a mining industry. I want to see, are you fit to work in a mining industry? So can I give you the certificate of fit? This is primary. Okay, this is a checkup, but this becomes primary. But if I say post placement examination, what is this? If I say post placement examination, guys, so post placement examination is after you are employed. Okay, after you are employed, meaning are you developing signs and symptoms due to working in a cement industry? Cement industry से किसका risk होता है? सीमेंट इंडस्ट्री में काम करने से आप किस ऑक्यूपेशनल डिजीज के रिस्क में हो? वर्किंग इन अ सीमेंट इंडस्ट्री, अनदर पोटेंशियल एमसीक्यू, वर्किंग इन अ सीमेंट इंडस्ट्री puts you at risk of which occupational exposure, guys? Very good, Chitranjan. Asbestosis. Okay, this can particularly come in FMG. Nowadays वो यही पूछते हैं, if you are working in a cement industry, you are at risk of. So once you start working in a cement industry, are you developing something due to asbestosis? So this is secondary level of prevention. समझ में आया? Everybody, ideally screening is secondary level, but sometimes some exceptions जैसे pre-placement examination is primary, post-placement is secondary. If I say pap smear, what is this? Pap smear for cervical cancer, primary, secondary, tertiary. Pap smear for cervical cancer, everybody. Pap smear. Pap smear for cervical cancer क्या है? Pap smear for cervical cancer. Pap smear for cervical cancer, very good, is secondary. Why? Because any woman who is sexually active should start getting a pap smear done. Why are you doing pap smear? हो सकता है because of being sexually active, cervical cancer has started, the pathogenesis has started, but she is not yet presenting with signs and symptoms. So we want to diagnose her before she progresses into stages which are not treatable. Did you understand? Okay. In coming sessions, we'll have more and more questions of levels of prevention. Don't worry. All right. Can I go to question number 3? Thumbs up, everybody. Can I proceed? Anyone has any doubt pertaining to levels of prevention question? You can keep it towards the end. Okay. I can give from 5 minutes to take up your doubts as well. ठीक है? अभी हम लोग अगले question पे चलते हैं. चलो बताओ. True about school health guidelines. One of the most important FMG topics, repeated topics. These are all PYQs, right? I have not started with the very latest years, but these have come before, so we are starting with the discussion of that. Minimum area 5 square feet per student minus test type can allot 60 students per classroom. Light coming from front of classroom. So now school health is a very important topic. Okay, who gave the concept of school health? School health concept was given by whom? Who remembers? School health concept, remember the planning committees, was given by किसने दिया स्कूल हेल्थ का कॉन्सेप्ट? एवरीबडी, स्कूल हेल्थ कॉन्सेप्ट, वेरी गुड, सर जोसेफ बोर. ओके, द कॉन्सेप्ट ऑफ स्कूल हेल्थ वाज गिवन बाय सर जोसेफ बोर. श्रीवास्तवा, नहीं आदित्य, Srivastava is for reverse the word RHS, Rural Health Services. Okay, school health. I'll give you question of health planning committees also as we proceed in our lectures. Okay, school health concept was given by Sir Joseph Board. Point number 1. Point number 2. It was improvised by whom? It was improvised by whom? Was it improvised by? Everybody, whom was it improvised by? This was improvised by रेणुका रॉय कमेटी. ठीक है, इसको बेटर किया, इसको इम्प्रोवाइज किया रेणुका रॉय कमेटी में. पॉइंट नंबर 3, रेणुका रॉय के अकॉर्डिंग स्कूल हेल्थ चेकअप शुड हैपन हाउ? स्कूल हेल्थ चेकअप शी recommended once every once every 4 years. But now, what does the current guideline say for school health checkup? Batao, batao guys. Current, very good Alia, 4 years, yes. But what is the current guideline saying? School health checkup should be done once every. Yes, school health checkup should be done not once every year, once every 6 months. These are things which you can't mess up. These should be in on your minds. Once every 6 months. Okay, very, very important. So first question, school health checkup concept was given by Sir Joseph Board, improvised by Ronika Roy, who said that school health checkup should be done once every 4 years. Current guidelines bolta hai that school health checkup should be done once every 6 months. Now let us look at the point. Minimum area per how much should be required per student? Minimum area 5 या कुछ और? What is minimum area? Tell me option A. Why is it wrong? Minimum area per student कितना होना चाहिए? These should now be on our tips, guys. Minimum area is very good, 10 square feet. ठीक है? Minus test type, absolutely correct at lower level. Okay, जैसे I have a study table right in front of me where I have kept my laptop. It is at a lower level. मेरे से ऊपर level में नहीं है. ठीक है? Can allot how many students per classroom? One classroom can allot how many students? One classroom कितने students होते हैं? Come on. One classroom, quickly. One classroom, how many students? I won't tell you. You have to tell me. 150? No. One classroom can avail up to, should have up to 40 students. Light should come from front of the classroom. No. Light should come from, this is false, left side of the classroom. Why it should come from the left side? Because most of us are right-handed. Okay? So up to 40 students is acceptable. Okay? Now see, I've written all it. One classroom up to 40 students, less than 40 students, minus test type. Doors and windows should constitute more than equal to 25% of floor area. One urinal up to 60 students. One latrine up to 100 students. Natural light from left side, minimum area per student more than 10 square feet, and school health examination once every 6 months. तो ये क्या हो गया तुम्हारे? All this is school health guidelines. Is it clear? What is this? School health guidelines. Clear everybody? Okay, school health checkup is important. I also told you school health checkup is which level of prevention? School health checkup is which level of prevention? Secondary level of prevention. Okay. All right. Moving to the next question. Chalo padho. Some look at epidemiology. Read it. Okay. What is your answer, everybody? A research study is being conducted on patients in rehabilitation. Impact of addiction among young adults, okay, was assessed on their subsequent divorce. Among the two groups of study subjects, divorced and non-divorced, history of alcohol drug was assessed. Which type of study? Okay, Everybody is writing B. My question to you is, why are you writing case control? Why is it not? See, rule out the other options. Learn to rule out your options. Why is it not cohort? Why is it not RCT? Why is it not descriptive? Why is it case control? Why do you think this study is case control? See, first of all, you have to figure out two things. What is the exposure that you are studying over here? So, the exposure that we are studying over here is alcohol and drug use. Okay? Exposure is what? Alcohol and drug use. And what is the outcome that you are studying over here? Outcome क्या पढ़ रहे हो यहाँ पे? Outcome, the one outcome that we are studying over here is divorce. Okay, now if I did a prospective cohort, I'll have to divide them into alcohol users and keep following them up for divorce, which is of no use. So we have clearly written that among two groups of study subjects, divorced and non-divorced, history matlab it is a retrospective study. Very good. Going from outcome to exposure. Yes, it's a retrospective study where you are taking the history of alcohol or drug use. And now divorce, although now it is becoming common, but still it's a rare outcome. It's a rare event. Not every couple is divorced. And when we have rare events or rare outcomes, what is the best thing to do? You take a population, okay, you divide them into all those who are divorced and all those who are non-divorced. Okay, divorced ले लो, non-divorced ले लो, and then you go back and ask them about, you go back and take their history about alcoholics, non-alcoholics. Okay, similarly among the non-diverse groups, how many are alcoholics and how many are non-alcoholics? Clear? So we are moving from outcome to exposure. We start with that rare event, we start with divorced, non-divorced, and फिर हम लोग पीछे जाते हैं. Okay, so moral of the story here is, you can't do a prospective cohort because you can't keep waiting for years for divorce to happen. RCT क्या होता है? Randomized control trial. It's an intervention. Here there is no intervention being done. I'm not giving a drug or something. Descriptive, in that we don't ask about the history. We just describe a population. ठीक है? So what I'm trying to tell you, whenever, see, this is a case control study design. You start with cases control and you go back asking about the exposure status. So what is important? Whenever you have rare outcomes, what will be your choice of study? Like if I want to study OCP use and breast cancer, so it's always better to start with people who have breast cancer and those who don't have, rather than waiting for breast cancer to develop, right? So rare outcome, case control, you start with that. Okay, all right, then next, okay, which study design helps me study multiple exposures? Batao, multiple exposures. You can study from which study design? Again, a important question from for FMG exams, also NEET PG. Okay, I'll tell you, Guru, criteria to select controls. Just give me a moment, okay? What is first? Put your answers. Multiple exposure, again, case control. Like I start with breast cancer cases, I can go back and ask them about OCP use, alcohol use, drug use, cigarette use, a lot of things. But if I have to study multiple outcomes, तब कौन सी study design? These are all golden points. बताओ. These are all golden points. Very good. Multiple outcomes, you can have a cohort study. You start with a group, divide into alcoholics, non-alcoholics, and then you go forward. You can look for lung cancer, or you can look for cardiovascular disease, a lot of other things. Okay. Now, how do you select the controls, guys? Controls are selected from the same area as the cases, but they should not have the disease that we are talking about. Okay, and one case के लिए how many maximum controls can you select? Again an MCQ. One case, how many maximum controls can you select? For one case, how many maximum controls can you select? Who knows? 1, 2, 3, 4, 5, 6, 7, 8. कितने? एक केस के लिए maximum कितने controls ले सकते हो? Very good, guys. Maximum 4 controls. But can you work with 1:1? Can you work with 1:1? One case and one control? हाँ, there is no problem. One case, for every case, one control. This is also sufficient. Okay, if the cost of collecting the cases and control is coming out to be the same, then one case is to one control is okay, but for one case maximum you can go up to 4 controls. So whenever you get a question like the one that we saw, first देखो what is the exposure, then see what is the outcome. Okay, then see is it a rare disease, then see are you going forward, are you going backward. If you can figure out those things easily, your answer can come. Okay, and if it's an intervention like a drug trial, it will be an RCT. Okay, chalo next. Yes, what is the answer to this? Any doubt you have any further pertaining to any study design, you can ask me before we finish the class. Okay, and I will tell you about it. Okay, chalo. More than 4 controls mein guru, usually you'll get the same data. Okay, it'll be like a data fatigue. You'll end up spending money and you'll not get any additional information. Okay. All right, so यहाँ पे क्या हो रहा है? Some are saying C, some are saying A. Okay. All right. Alia, what is your answer? Okay. Alia is saying Ojai. Vignesh is saying B. Anybody else? Rahul is saying 1. So most are saying A. Okay. And some of course are saying C. Ab dekho, let's try to understand this. Okay. A researcher undertakes a follow-up study. What is a follow-up study? Follow-up study means a prospective cohort. Okay. He's taking up a prospective study for a certain time period duration and tells that the people increasingly develop disease with time. That means, what is the meaning of this? That as time is moving, people are increasingly developing the disease. That means more and more cases are being added up. समझ रहे हो? More and more cases are being added up, meaning there is no dip. There is no dip. And when there is no dip, okay, it's not just plain incidence. It's like something which is a very characteristic point over here, that people are increasingly developing disease with time. Increasingly developing, no, it's not prevalence. Now those who have marked option C, it's a follow-up study. Follow-up kabhi prevalence nahi batata. Prevalence is given by a cross-sectional study, and cross-sectional study may you neither go forward nor backward. In a cross-sectional study, you are at one point of time. Okay, cross-sectional study may you are like stuck at one point of time, and it is telling you about the prevalence. Okay, the total number of cases of a disease. Okay, you are at one point of time. So prevalence definitely not the answer. You should have ruled out, guys. जब भी मैं follow up बोलूंगी, follow up बोलेंगे, that means it is not a cross sectional study. You are not doing at one point of time. You are moving forward, and the cases are increasingly increasing with time. So cumulative incidence. What is cumulative incidence? There is no dip in the number of cases. There is no fall in the number of cases. Cases are continuously being added up. Are you understanding? Cases keep on being added up. Add होते जा रहा है, होते जा रहा है, होते जा रहा है. So people increasingly they are developing the disease with time. So this is what cumulative incidence. All right, everyone. Now, how does this cumulative incidence is represented by a statistical graph known as ogive? How does it look like? See, can you see an ogive? There is no dip. This represents, this is an image-based PYQ. This represents cumulative incidence. Okay, the cases are continuously increasing. There is no dip. Which is that diagram which tells me about increase in the cases, decrease in the cases? उसको क्या बोलते हैं? which is that attack rate is simply like incidence amulya. Okay, an attack rate is used particularly when there is an outbreak there. Okay, so other question, this is also a PYQ, guys. They have asked you this diagram is used to do what? So this everyone is line diagram. And what does line diagram represent, guys? This represents the, yeah, the question, okay? Trend of an event with time is represented by a line diagram. Any trend of a disease or incidence of a disease. Now, incidence of a disease, if it was always increasing, cumulative. But incidence of a disease with time, again, what do we have? We have a line diagram. It's increasing, decreasing, increasing, decreasing. All right, everybody. So did you see this is also a PYQ, guys? Line diagram is used to uh, represent what? Trend of an event with time or incidence of a disease with time. But if the cases are constantly increasing, तो हमारे पास क्या होता है? You have cumulative frequency curve और हो जाए, ठीक है? All right. Can we so just have a look at the question once again and try to figure out why the answer was cumulative incidence? A researcher undergoes follow-up study for a certain time and tells the people the disease is increasingly developing disease with time. All right. So here it's very important that it's a follow-up study. So prevalence is out. Prevalence is given by a cross-sectional study which is done at one point of time. And since the cases were constantly increasing, it is cumulative incidence. Okay. Proceeding to the next one. Yes. What is this? What is the answer? What is this NPCDCS, everybody? Anyone can tell me the full form of NPCDCS? अच्छा, what is this NPCDCS? पहले प्रोग्राम का नाम तो बताओ and then we'll do some questions for this. NPCDCS is National Program for Prevention of Cancer, Diabetes, and stroke. Now, obviously, what diseases come over here? CVD, diabetes, stroke. Okay? They gave in FMG exams. But you can also get the image, identify through the logo of NPCDCS. कैसा है logo, guys? Can you appreciate this logo? National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases, and Stroke. Please look at the logo, everyone. Health in your own hand. Okay, we have to take care of our health by ourselves. And if I ask you which level of prevention is the best for control of NCDs, which level of prevention is best for control of NCDs? What is your answer? Which level of prevention is best? Primordial, primary, secondary, or tertiary? Which level of prevention is best for control of NCDs, guys? Do you want people to start smoking? Do you want people to smoke? Do you want people to drink? So for control of NCDs, it is primordial. We don't want them to develop any risk factors. Okay, this is important. Which level of prevention is best for control of NCDs? So it is primordial. We don't want the people to adopt any risk factors. Okay. Now few points under this. New initiatives. Now please look at it very carefully because it's an update also. New initiatives under NPCDCS. So now we have also included what other diseases in NPCDCS? We have included COPD and chronic kidney disease. Important. Okay, we are also talking about integrating what? We have integrated the various integration with the various Ayush modalities. Okay, integration with Ayush modalities. Then we are also talking about rheumatic heart fever, rheumatic heart disease, and rheumatic heart disease and rheumatic fever screening under screening. So as a part of Rashtra Bal Swasth Karyakram, this has been integrated with NPCDCS. We were screening for rheumatic heart disease in Rashtra Bal Swasth Karyakram. You remember from 0 to 18 years, Rashtra Bal Swasth Karyakram. Okay? So under Rashtra Bal Swasth Karyakram, we were screening for rheumatic heart disease and rheumatic fever, and that we have also integrated with NPCDCS. Is it clear? So that is again an important point which you should know. Also, we are doing what? RNTCP, which is now National TB Elimination Program plus NPCDCS. Okay, particularly for among diabetic people, okay, among people who have suffering from TB, diabetes is very commonly reported. So TB and diabetes we are including under NPCDCS. Okay, Jai Vigyan Mission is a very old program. Okay, that is for rheumatic heart fever. Okay, rheumatic heart disease and heart fever. We were talking about vaccine development and prevention mostly in Jai Vigyan Mission. But these are the new initiatives in NPCDCS. Strategies we all know to control NCDs is health promotion, early diagnosis, timely, affordable, accurate diagnosis, access to affordable treatment, rehabilitation, supervision. This is not that important. Okay. Coming to the next question. So you have to remember the logo, which was very important for NPCDCS. Oh, I missed an image. Sorry. ये image एक बार just look at this image once, because you know maybe you can get a question from this. At sub center we are looking for health promotion, opportunistic screening. ठीक है? Opportunistic screening क्या होता है? I have gone for checkup for some other disease, but I took an opportunity and I got screened myself. The doctor screened me for something else also. There is no level of PHC over here. At CHC, we have early diagnosis management. District hospitals, we have cardiac care unit. I want you to make a note of this. District hospitals, you have cardiac care unit and cancer care facility. These two things. Okay, from which level onwards do you have a separate cardiac care unit and cancer care facility? So it is at district hospital. Okay, chalo, let us go to this one. A doctor is teaching an intern about knee reflex demonstration. What type of learning is this? This question also got repeated in NEET PG exams, guys. Okay, so I told you for PSM questions from FMG go to NEET PG. NEET PG के लिए कुछ questions come from for FMG. Okay, so what is this? Very good. Psychomotor learning. Now tell me a few questions on learning. Learning is a temporary change or a permanent change? This is important. लर्निंग टेम्पररी होता है या परमानेंट होता है? This is an MCQ. Learning is something temporary or permanent? No. Learning is permanent. Okay. Learning is permanent. Remember, learning is permanent. There are three types of learning. One is cognitive. So cognitive is based on knowledge. Okay. Then the next one is affective. Affective learning is based on attitude. Okay. Your actions. And what is the last one? Psychomotor. Psychomotor learning means skill development. Okay. Psychomotor learning is what? Skill development. Remember, learning is permanent. Okay. Learning is permanent. Three types of learning. Cognitive is based on knowledge. Affective, attitude, action-based learning. Psychomotor, skill development. So here an intern is being taught about knee reflex demonstration. That is psychomotor. Teaching a child hand washing technique. That is again psychomotor learning. Okay, these are all important questions. They keep coming in our exams. So written over here, cognitive. See, learning is a relative permanent change of behavior. Learning associated with knowledge is cognitive, associated with attitude is affective, and associated with skill is psychomotor. ORS preparation is more like a demonstration. Okay? ORS is demonstration. You teach someone, then ask them to do that also. So it is psychomotor. You are enriching the skills of a person, plus it's a type of demonstration. Chalo, what is this? I'll show you a lot of image also with this PYQ. Under ICDS, intersectoral coordination is found with ICDS is Integrated Child Development Services Scheme. Okay. Okay. Vinay is asking example of effective learning. See, something based on attitude. Now, Vinay, you are posted in emergency today, and your duty gets over at 8 o'clock. But as soon as you were, exiting, and your colleague has said that he's entered the hospital, he is reaching, you go. As soon as you are exiting, a trauma patient comes in. How will you behave? That is effective learning. Okay. Some patient of yours tells you that has some cancer, and he requests you, don't tell it to my wife or to my parents. What will be your attitude towards that? Okay. So that is it. All right. Now, what is that intersectoral coordination in NHM? Why? Intersectoral coordination is what, if you remember, intersectoral coordination is a principle of primary health care, or you could also say principle slash pillar. Okay, principle slash pillar of primary health care. All right. What are the other principles of primary health care? There are 4 principles. Since they have asked, let's study it. Community participation hota hai. Okay. What else? Appropriate technology. What else, everybody? Equitable distribution and intersectoral coordination. Intersectoral coordination means that health sector can't work alone. It needs support from the other sector. Now, if you see what is NREGA, what is option A, everybody? Yes, community participation. That is also an FMG PYQ. All the grassroots level workers, Asha workers, she is an example of that. Appropriate technology means cost effective but quality services like ORS, Shakir's tape. Okay, vaccine while monitor, kangaroo mother care. All these are appropriate technology. Okay, now what is NREGA? The 100-day program, National Rural Employment Guarantee Act. It is not needing any intersectoral coordination because it is under the Ministry of Labor. Alone it is functioning. Okay, so 100 days of guaranteed wage employment. Under NREGA scheme, it is 100 days of guaranteed wage employment, right? 100 days of guaranteed wage employment to all those employees who agree to do unskilled manual work. They have to belong to below poverty line. National Leprosy Eradication Program, AIDS Control Program. They are working mostly in coordination with health sector. NHM is a, now what is NHM? One second, before we go to the image. NHM is the overall body, everybody. Okay, it's like the overall umbrella. Okay, so NHM में क्या क्या include होता है? NRHM. NHM also includes NUHM. NHM also includes RMNCH plus A. Important. NHM also includes the control of which diseases? The control of communicable diseases. Okay, and NHM also includes the control of non-communicable diseases. So NHM में कितनी सारी components are you understanding? So there's, and this could also come, all are components of NHM. It's looking after NRHM, it's looking after NUHM, RMNCH plus A, control of communicable disease, नॉन कम्युनिकेबल डिजीज, सब कुछ एनएचएम के अंदर है. सो इंटरसेक्टोरल कोऑर्डिनेशन इज needed. Okay, yes, it's like an umbrella. Let us have a look at images. Look at the first image. Whatever options were given, okay, I'm showing you the images also for them. Image important. I'll be starting a separate image based revision also for my FMG students. Okay, so when then we'll be looking at all the images in detail. But this one is National Health Mission. It's like an overall umbrella. See, for all the programs, the sun is shining on the entire family. What is this image? ये कौन सा image है जहाँ पे lotus बना हुआ है? ये किसका image है? Where you can see the lotus symbol. Very good. So lotus symbol, National Leprosy Eradication Program. NACO, National AIDS Control Program. Now look at this smaller logo over here. Sorry, next to Gandhi ji. Can you see this logo next to Gandhi ji, everybody? Okay, where people are doing unskilled manual work and there is written 100 days ऐसे करके. Okay, NREGA. All right, so here you can see this. Yes, NREGA scheme. Clear? Everybody, okay. Lotus is a symbol of hope. Okay, no stigma, no this thing, rogue free. Okay, that is for leprosy. Understood? Can we go to the next question, everybody? Okay. Few more minutes to go, 15-20 minutes. Let us see this one. A very common question for FMG exam. Last time in NEET PG papers, 2 questions they have given from this topic. A patient presented with rash and diarrhea since 2 months. Identify the deficiency. We all know this is niacin deficiency. Rash and diarrhea. Now look at this image also. You can see this and you can see his hands. Bilateral dermatitis. Hyperpigmented patches. Okay, are they hypopigmented? No. They are which patches? Hyperpigmented patches. Okay, and you can also see this thing, a rash which has formed on sun exposed areas. Okay, this is what, this is also known as, very good, castle's necklace. Okay, क्या बोलते हैं इसको? We also call it as castle's necklace. Now what is niacin deficiency? See, this image can also come, castle's necklace. Now niacin vitamin, okay, deficiency of niacin leads to what, everybody? It leads to pellagra. Pellagra is characterized by how many D's, guys? How many D's? So there is diarrhea, there is dermatitis, okay, then 6 D's, 4 D's. How many D's? 3 D's. Okay, how many D's? Diarrhea, dermatitis, dementia, delirium, depression and death. Okay, so how many D's हो गए everyone? 6 D's. Okay, niacin deficiency has 6 D's: diarrhea, dermatitis, dementia, delirium, depression and death. Now this deficiency is very particularly noted in, deficiency is also noted in, which came in our exam, maize eaters. What happens in maize eaters, guys? Tryptophan, okay, gets converted to what? Tryptophan gets converted to niacin. All right, but in maize eaters क्या होता है? In maize eaters there is excess of leucine, okay, excess of leucine, which prevents the conversion of tryptophan to niacin. Therefore we manifest niacin deficiency. It's not like tryptophan is deficient. There is actually excess of leucine which prevents the conversion of tryptophan into niacin. Is it clear? This question can come. And how many milligram of tryptophan gives how many milligram of niacin? 60 milligram of tryptophan gives us 1 milligram of niacin. Okay, this is also an important knowledge based question. Is it clear? All these questions keep coming. 60 milligram tryptophan, 1 milligram niacin, and even in jawar and sorghum eaters, niacin deficiency is seen. Okay, so this was an important question. Now look, A farmer is, this came in NEET PG. A farmer is having complaints of skin rash which increases on sun exposure. So on sun exposure, that is increasing. That means that is hyperpigmentation, redness of tongue, maize is staple diets. So again, which of the following vitamin deficiency? Niacin deficiency. Different ways in which the same question has been asked. ठीक है? Same question को अलग 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 वे से पूछा हुआ है. So wherever you see a question like this will be your answer. We all know this is maize. Look over here. Skin rash and pellagra appear as pigmented and scaly in areas exposed to skin, sunlight. Okay, chalo. This we have already done. Okay, another way in which a question was asked. This question, same topic was asked in NEET PG. See, last year's NEET PG. I'm showing you because questions keep getting repeated. You must look at PYQ of NEET PG also for at least last 2 to 3 years before you go for your FMG exams. It will really help you. A 45-year-old man presents with following skin chain. What relevant history will you take? So obviously you will take diarrhea, dementia, and dietary pattern you're going to ask for. Okay, so that was the answer. So one question, one topic has been asked in different exams, also in different manners. Okay. Next PYQ. Maximum thickness of lead apron required is simple knowledge based question. Batao answer. Okay. कुछ कह रहे हैं B, कुछ कह रहे हैं D. B ऑप्शन क्या है? 0.2 mm and some are saying D, 0.5. Yes. Maximum thickness which is recommended of lead aprons is 0.5. Read these golden points. 0.25 alia is only useful for mammography. Okay, thickness of lead aprons. All right, so when you talk about this, 0.2 mm is only useful for mammography. Okay, but 0.5 mm most widely used. It is able to attenuate more than 90% of scattered radiations. 1 mm very heavy for daily use. Okay, no, recommended is not 1 mm. It's very heavy for daily use. 0.5 mm is widely used, and if it is to do with mammography, 0.25 mm. Okay, rabies free state in India. We all know rabies free. This was asked in one of the papers. बताओ सिक्किम, JNK, अंडमान निकोबार, राजस्थान क्या है आंसर इसका? Very good. Rabies free is Andaman Nicobar Islands, wherever there's water, Lakshadweep Islands. Okay, all right. Niti Ayok has replaced. What is the answer to this? National Board of Examination, Medical Council of India, National Planning Commission, Ministry of Health and Family Welfare. So Niti Ayok has replaced what? Niti Ayok has replaced, yes, National Planning Commission. Let's have a look at some points of Niti Ayok. Number one, guys, what is the full form of Niti Ayok? What does Niti Ayok stand for? It is National Institution. Nobody will say institute. ठीक है? Institute नहीं है. It's an institution. National Institution for Transforming India. Since this has been asked, any question from this topic can come. Second point, it replaced what everybody? It replaced the planning commissions of India. Earlier we used to have the planning commissions. So it replaced the planning commissions. When was Niti Ayok formed? So Niti Ayok was formed on 1st of January 2015. Who is, like, what is the main work of Niti Ayok? It is also called as, ये अच्छे से देखो, think tank of India. What is it also called as? Think tank. So they can give you think tank of India is Niti Ayok, NHM, Ministry of Health and Family Welfare, कुछ भी दे सकते हैं. That means it frames all administrative, like all administrative policies and programs. Okay, it's responsible for framing all administrative important policies and programs, everybody. Okay, so that is your Niti Aayog. Who is the chairperson of Niti Aayog? Who is the chairperson of Niti Aayog? So chairperson is the Prime Minister. He is the in charge of Niti Aayog. And who are the members of Niti Aayog? Who are the other members? The members are all the chief ministers of the various states. Okay, members कौन से हैं? Chief ministers of various states. All right, it's the chief ministers of various states and lieutenant LGs. Okay, lieutenant governors. Is it clear? You must remember these few points about Niti Aayog. It is responsible for framing all important administrative policies and program. Who is the chairperson? All these questions can come in your exam. It replaces the planning commission. Okay. So see, functions of Niti Aayog: acts as a resource center and knowledge hub. ये आ सकता है. Which is the resource center and knowledge hub of India? Niti Aayog. Designs all policy and program framework. Fosters cooperative federalism and also for monitoring and evaluation. ठीक है? It is also acting as a resource center and knowledge hub. ठीक है? All right. An important question for the day. A screening test is used for a disease in a population. What does the interval between B and Y represent, guys? What does the interval between B and Y represent? कहाँ है B? This B and Y. ये क्या represent करता है? Okay, so some are saying lead time, some are saying incubation period. Okay, so now देखो, what is B? What is B? What is A? A is disease onset. B क्या होता है? First possible point of diagnosis or detection. ठीक है? What is X? X is the critical point of detection. And what is Y? Y देखो is just before the outcome. So Y is the final point of okay. So final point, or you can say not instead of final point, say usual point. Okay, usual point of diagnosis is point Y. Now usual point मतलब क्या होता है? What is the meaning of usual point of diagnosis? Usual point of diagnosis means that now signs and symptoms are गए. ठीक है? Signs and symptoms have come. Then only you can diagnose. Signs and symptoms have appeared. Now the real question is, can you diagnose a disease before the appearance of signs and symptoms? Yes. So instead of applying a diagnostic test at point Y or a test at point Y, when signs and symptoms have come at usual point of diagnosis, we are going to apply a test at point B. Okay, हम कब टेस्ट अप्लाई करेंगे? At point B, when the person does not present with any signs and symptoms. Okay, so we will try to identify the disease before the person presents with signs and symptoms. That means pathogenesis has started in his body. So instead of applying a test at point Y, we will apply the test at point B. So we are gaining in this time period. We are leading in the detection of the disease by which time interval? B to Y. This is known as lead time. Lead time क्या time signify करता है? The time that you are gaining by applying a test at point B instead of point Y. समझ में आया? What did I say? The time that you gain, okay? The time that you gain, okay? In detection of a disease, all right? In detection of a disease, all right? By applying a test, where? By applying a test at point, किस point में हमने लगाया? At point B. By applying a test at point B instead of Y. Okay, instead of Y. Y is the usual time when the person will present with signs and symptoms. We want to catch a person who is developing a disease early in the pathogenesis period. तब उसको signs and symptoms भी नहीं है. So we want to identify the disease at point B. So this is what lead time. Okay. Critical point क्या होता है? Access critical point. That means if you want to get advantage of a screening test, please apply it at least till point X, because beyond that you will not get any added advantage. Okay. And why do you apply a screening test? To prolong the survival, so that you can catch a disease on time and you can prolong the survival of the patient. So to get the advantage, एक टेस्ट को एटलीस्ट पॉइंट बी पे लगा दो. ठीक है, एटलीस्ट पॉइंट एक्स तक तो लगा ही दो, अदरवाइज द बेस्ट प्लेसेस टू अप्लाई एट पॉइंट बी. Okay, what is incubation period and latent period? What is incubation period? I hope all of you know. Incubation period is the period between entry of organism and what? Entry of organism and appearance of entry of organism and appearance of first sign and symptom. So here incubation period is entry of organism A to Y. All right, appearance of first sign and symptom, not A to B, A to Y guys. Organism A पे enter कर चुका है and first sign and symptom will appear at point Y, which is the usual point of diagnosis. Okay. And incubation period for non-communicable diseases उसको क्या बोलते हैं? That is known as latent period. Okay. Incubation period for non-communicable diseases is known as what? Incubation period for non-communicable diseases, everybody, is known as latent period. Okay. All right. Going to a few more questions. Yes, our very own Asha worker. Let's do this one last question. Asha worker के बारे में कुछ points discuss करते हैं. ठीक है. All right. Asha worker in rural areas is designated for how much population? Very good. Very good. So it is 1,000 population. Now I'll tell you some golden points about Asha worker. Okay, follow with me. Accredited social health activist. Point number 1. Okay. Asha worker is who? Who is a Asha worker? She is a resident of the local resident of the community. Okay. She is what? She is a local resident of the community to which she belongs. That is the first point for Asha worker. Okay. What is point 2? What is point 2 everybody? Point 2 क्या है? She is a married woman. Alright. Or she is a divorced woman. ठीक है, but she is never going to be an unmarried female. Alright. Then what is her age group? Her age is 25 to 45 years. Alright. Fourth point. Educational qualification आशा का कितना है? 10th pass, not 8th pass, please. It is 10th pass, everybody. She is 10th pass. Whether it's hilly area or plain area, she has to be 10th. No, Guru, it's not 8th. She has to be 10th pass, whether she's from plain area or hilly areas. नहीं मिलती है, then we go for an 8th pass. But 8th pass is not a criteria. Please remember, criteria for both plain, ठीक है, and hilly area, okay, is what? It is 10th pass. Just give me one moment. मैं आ रही हूँ, 1 second. Okay. All right. So educational qualification, everybody, is what? Educational qualification is 10th pass. Okay. Whether in plain or in hilly areas. ठीक है. Then fifth, what is the existing population norm for Asha worker? Existing population norm कितना है for Asha worker? 1 per 1000 population. Like for every 1000 population, we have one Asha worker. But what is the proposed population norm, everybody? Proposed population norm कितना है? What is the proposed? Proposed is 2 per 1000 population, which we should have at least 2. Okay, that is proposed. That's not existing. Existing is 1 per 1000. फिर से देखो, resident of the community where she belongs, she can be a married woman, a divorced woman, age 25 to 45 years, educational qualification, 10th pass, plain area, hilly areas. Existing population norm is 1 per 1000 and the proposed population norm is 2 per 1000. Next point, point number 7. Asha is selected by, who selects an Asha worker? So Asha worker is selected by a village panchayat. Remember this. Asha worker is selected by a village panchayat. Under supervision of whom? Under supervision of that local residents? No, she is selected by a village panchayat under supervision of a medical officer. But select होगी village panchayat के through. Accountability is towards whom? Accountability towards village panchayat. She is accountable to him. What is the duration of training, everybody? Duration of training. Duration of training of Asha worker is 23 days. All right, over a period of 1 year. Who is going, point number 10. Who is going to train Asha worker? So training of Asha worker provided by, training of Asha worker, कौन ट्रेन करेगा इसको? ट्रेनिंग ऑफ आशा वर्कर इज प्रोवाइडेड बाय आंगनबाड़ी वर्कर और एएनएम. एनीबॉडी कैन ट्रेन हर. ठीक है. पॉइंट नंबर 11. शी इज एन एग्जांपल ऑफ, okay, she is an example of what, everybody? She is an example of community participation. अभी पढ़ा था. Very good, Ramesh. She is an example of community participation, a principle of health care, primary health care. And what is her main function? Main role क्या है आशा वर्कर का? Main role और main function क्या है? She is a mobilizer of the community. Okay, she is a mobilizer of the community. Okay, can she give vaccines? आशा वर्कर वैक्सीन्स दे सकती है क्या? वो वैक्सीन्स डिलीवरी can she inject vaccines? No. Can she conduct deliveries? No. She cannot inject vaccines. She cannot conduct deliveries. She is a mobilizer. She can help maybe in delivery, but वो conduct नहीं कर सकती delivery. Vaccines नहीं लगा सकती. Her main role is mobilizer. Mobilizer means like she has to collect the children, ensure that they come to the vaccination clinic. She has to get the woman, like she needs to ensure that pregnant females come to the healthcare setup. Okay, yes, she can act as a dots provider. Anybody can act as a dots provider. Mohit, कोई भी dots provider act कर सकता है, except who cannot act as a dots provider, guys? Who cannot act as a dots provider? Anybody can act as a dots provider, except who? Except the relatives of the parents of the own patient. Okay, parents of the own patient, they cannot act as dots provider. And to act as DOTS provider on successful treatment completion of new and previously treated TB patients, she gets rupees 1000. MDR XDR के लिए she gets rupees 5000. But so far today you will remember these golden points. She is a resident of the local resident of the community, a married woman or divorced woman, not a single unmarried female, 25 to 45 years, 10th pass. Existing population norm is 1 per 1000. Population proposed is 2 per 1000. Selected by a village panchayat under supervision of medical officer. Accountability is towards village panchayat. Duration of training is 23 days. Training of Asha worker is provided by Anganwadi worker or ANM. Example of community participation and main role, she is a mobilizer of the community. She is a depot holder. She can distribute contraceptives. Okay, she distributes also, like emergency contraceptive भी distribute करती है, ठीक है, she can distribute that. Now incentives, of course I'll be telling you, like I told you, one is treatment of new and previously treated TB patients 1000, MDR XDR 5000, ठीक है. Then she also gets a lot of other incentives, like if she is able to motivate a couple to delay the birth of first child after marriage by 2 years, 500 rupees. Motivate a couple to space 2 years between two pregnancies, 500. Sterilization के लिए अगर she is able to motivate a couple, okay, so rupees 1000. So I'll have a class on those incentives also. Okay. Now coming to the last question for the day, calculate neonatal mortality rate. Look at this and calculate one numerical for the day, everybody. So what is neonatal mortality rate? It is the death of a neonate per 1000 live births. Now, why is it like neonate means first 28 days, death between first 0 to 28 days, and per 1000 live births. Now see, here you've been given total live births for 4000. Okay, so I have the denominator over here 4000. Total deaths among 0 to 7 days baby was 40. The 7 to 28, 40. More than 1 month, I am not bothered. Into 1000. So this becomes 80 by 4000 into 1000. So this becomes how much? 20 per 1000 live births. So the answer over here becomes 20. Okay, we'll be revising all the formulas also. Remember for today that when we talk about neonatal mortality rate or infant mortality rate, neonate is death between 0 to 28 days. Early neonatal mortality rate is death in the first 7 days of life. Late neonatal mortality rate is 8th to 28th day. But everywhere per thousand and live births रहेगा. And what is post neonatal mortality rate? Post. Post मतलब after 28 days to 1 year. ठीक है. All right. Most common cause of early neonatal or neonatal mortality rate is, what is the most common cause of NMR? It is low birth weight or prematurity. Okay, low birth weight or prematurity. Okay. So I think we've revised a lot of questions today. Remember whatever PYQs we have done. Yes, infant may 0 to 1 year. 0 to 1 year. I'll be telling you how to revise all the formulas once we come to formula based class. Okay. But in neonate होता है 0 to 28 days. Early neonate होता है 0 to 7 days. Late neonate होता है 8 to 28 days. Post neonate होता है more than 28 days to 1 year. ठीक है. Infant mortality rate is 0 to 1 year. Under 5 mortality rate is 0 to 5 years. Okay? So that was it for today. I will be planning again a session soon for PYQs. PYQ session will continue to be held on Unacademy YouTube channel. Follow the Telegram groups, Unacademy Telegram group and my Telegram group also for the links of the classes. Okay? NICT PYQ, I have taken classes before. They will be available on my profile on Unacademy. Okay, but we will be doing NICT PYQs in the month of October also. Okay, so those will also be covered. Before that, guys, just remember today is the last day to avail this Unlock 20% off on any iconic or plus subscription on Unacademy. You can use the code PSM10 PSM Live. We have a last minute revision batch, ultimate revision batch for NEET PG. Okay, with all these wonderful educators and many more. And we also have FMG December exam के लिए a last mile revision. ठीक है? So I hope you enjoyed the session. We've had quite a long session. We've discussed a lot of PYQs. Don't give up. Keep revising. And don't lose heart, don't lose hope. This is one, this is just a phase of life. It too shall pass. Take it with full, face it with full dedication, devotion, and determination. All right, everybody, I'll see you soon. Keep following the Telegram groups for the links of the classes on YouTube as well as Unacademy app. Okay, bye bye. Have a good day. Stay safe and be happy. All right. Take care, everyone. Thank you so much.